Om Amriteshwarye Namaha. Humble pranams at the lotus feet of our beloved Amma. I assume that all of us remember our journey for preparing and appearing for NEET before joining the MBBS curriculum. Not only for medicine, but all the courses have competitive exams. As from an educational point of view, everyone might agree that they have an effect in encouraging hard work. We have an exam to face in the future. We don't know if it's NEET or next, for sure, but we all need guidance to ace it. And today, it's a matter of pride and honor for us to have eminent doctors with us who will be shining light on this aspect and helping us face our fears. Now, I would like to introduce our moderator for the session, Dr. Colonel Vishal Marwaha. He's a veteran of Indian Army for 28 years. He did his MBBS and MD from the prestigious Armed Forces Medical College, Pune, and DNB in Internal Medicine and 2 years of fellowship in rheumatology at AIIMS, Delhi. He did a short-term training at Nottingham, UK. Currently, our beloved principal at Amrita Institute of Medical Sciences, Kochi for the past 5 years. Now, I kindly request, sir, to introduce our eminent speaker for the day. Over to you, sir.
Thanks, Arunima. Om Amriteshwaraye Namaha. Humble pranams at the lotus feet of dear Amma. Most of the students, what I encountered in the last 5 years as principal of AIIMS, Amrita School of Medicine, was that, there are people who want to go to US, there are people who want to go to UK, there are people who want to study in India. So either way, they have to clear the exams. They have to clear the NEET PG or lab or USMLE. So it's a huge challenge for everyone to, prepare for these exams. So a lot of knowledge keeps coming when you are attending, when you're listening to the various students who have cleared the exams, their journey, then from the various organizations who teach like Kaplan, we have luckily had exposure to all these. They taught us a lot. I still remember Tenzing Jamyang, Dr. Tenzing Jamyang from Kaplan. He asked one of our students, if I have to fight with you after 6 months, how will you prepare? So he said, I will exercise, I will do this, I'll do that. He says, no, you lose the bout. He says, why? Because you didn't study me. So it's so important to understand what is the exam. So today we are lucky that we have Colonel ASHUTOSH OJHA. He is my very good friend and was in college. We were in college when I was doing my MD. He was just about finishing his MBBS. So we have a very long attachment, bonding with each other. And then we were in the uniform together for a long period of time. I quit. He also quit. Presently, he is professor of medicine at Somaiya Medical College, Mumbai. MBBS from AFMC Pune, MD General Medicine, INHS Aswini, Mumbai. Subsequently, he has done Diploma Hospital and Healthcare Management, Diploma in Medico-Legal Systems from Symbiosis Center for Healthcare, Postdoctoral Certificate in Dialysis Medicine from Guwahati Medical College, where he, I think, stood first also. Not written here, but I remember. Fellowships, Geriatric Society of India, National Academy of Medical Sciences. He is a fellow of the American College of Physicians, member of the Royal College of Physicians. But I think these don't really define him well. I think the best way I would like to introduce Colonel OJHA is he is a wonderful teacher. I think it's just a matter of time. Last time also when he spoke to the students were highly, motivated, and I requested him to take some classes for our students also. One, he's a wonderful teacher and he's a very, very, very good mentor. That's a very important thing. He's a mentor in many groups also, which offhand I'm not remembering right now, but he, he has the ability to, push you. I think that's some of the very, very quality which doesn't come very easily. To mentor is not easy. Here as a principal, I have to work as a mentor. Mentor means it is like, a lot of people will have a lot of doubts. You have to clarify them, and then they'll have self-doubt. You have to get that out. You have to make them move. So that is something which is so important. And again, today's perspective lecture by him on how to face NEET next will be, I'm very sure, a wonderful one. So without wasting any more time, I will request Professor Colonel Ashutosh OJHA to please address all the delegates attending this session today. Thank you very much.
Thank you, sir. This is very important lecture uh, for the students across the country and otherwise. This is something revealing how we take exam, where to go about, and what is expected out of you. And the PG entrance exam and the entrance exam for Institute of National Importance. These are the two one in which if you do well, your career is well settled. Because there are two aspects of it. We as a teacher and the medical planner, we feel that the only IMG, Indian medical graduate, is not enough. Simultaneously, we do believe that the quality postgraduate education, research, and further to improvement is the call of the day. Because the country faces a tremendous problem of doctor to patient ratio, inappropriate aggregation of doctors countrywide, and still a lot many areas where the scientific medical help is not available. With these challenges, we have to progress to the level where our people have got right to health and they prosper in all dimension of health. I am really thankful to Colonel Marwa sir. This is my humble prayer in the lotus feet of Amma, that who has always been guiding to all. And I just do, please bless her wisdom to do right always. And that is my small salutation to the great lady and institution. I do make disclaimer. I will be quoting different text, concept, figure, MCQs just to explain facts and main ideas. They are neither my recommendation nor assumed to be high yield points. Please don't take them that you mug up those points. These will be only illustrations. I will acknowledge the sources there only, and there is a no conflict of interest as a teacher or examiner for me. And I have got no financial gains other, and my whole aim is to empower a student to do well in these exams. First and foremost thing you should understand, preparing question is a long process in which there is a huge question bank has to be created, and it involves at least all faculty contributing nationwide with their every year something like every faculty professor is asked to prepare a set number of questions, and he is supposed to send it in to the board, which is further to handed over to NTE or NEET body as required. These questions are well deliberated. There is somebody who sets it, Then after there is, it is goes to the board, which board of studies, which comprise of at least peer reviewed 3 professors. They go through this, and then after there is a validator who goes through all the question process. He sees that what this concept he's asking, whether it is relevant today. All the options are evaluated, whether they are candid, clear, or is there any overlap or something like that. And these things are checked multiple times, peer reviewed, then after validating. After validating, it is said that it is well conceptualized, and then correctness of thread, and then after correctness of the uh, proof is again done by expert only. So that is how this whole process involves at least 5 to 6 hands, well trained hands, to develop one question. And what I will advise the students, never doubt a question. If you doubt that the examiner has prepared the question wrongly, you rarely will be right. We will give you the data, what is the 10 years data with us, how many time questions are put open due to mistakes. Second thing I want to put you straight is that the questions are framed afresh. You cannot, they are not taken over from any guides, be it Balu, Mathur, or anybody you guide. Because most of the teachers who develop these questions, when they forward, the first thing peer review, we do the plagiarism search. If anywhere it is found, we just cancel this. So what is happening, that all the questions are framed afresh, they are to be put in. And second issue is that when it is the problem based question, or the scenario based question, or clinical situation based question, it has to be relevant in today's exam, something like that it should be relevant to 2021. So that is why we have to think that the any popular guide or the question bank you follow, the question will be ditto from that. It is nightmare. You should not do, because the process is very robust, and it is developed every year. And then after plagiarism search and other things, you can't miss it. This is a professional software which is very, very good. Even 5 consecutive words repeated anywhere, it will come in the plagiarism. So that is why you have to, don't depend on any one guide, depend on your textbook. Most of the questions which are coming are from the recent edition. You will not find the questions from older edition, even if the question bank has put it in. So while validating and evaluation and proofreading process, we do change or we improve upon the questions so that it must contain the recent edition values, data, and concepts. So that is very, very important. Tables, figures, and footnotes, these are also part of that. Because when we develop the question, there is something like must know. There are significant part of the questions will be from NEET particularly, that will contain must know. Means everybody should know it, only then they pass. Because we are giving that eligibility also. So for eligibility, we have to fix the minimum eligibility. For that reason, we give lot of questions of must know series. When it comes to the institute of national importance, that is, it comprises mostly of preferred know or the recent advances. So these are the two things you have to understand. And for that, what is are the important thing, that the footnote and tables are very important one. Sometimes errata is also used. You see, I have gone through 2 times the exam. I have found out in the super specialty exam, the errata which has been issued have been taken from that. And if you somebody is preparing for super specialty exam, I don't think they will be much in this group. you have to go with the soft chapters also. You see, all the books now have coming from the hard print chapters and the soft print chapters. And some of the soft print chapters, the students don't read. It is not that in Somaya or FMC don't read, but it is universally they hardly bothered to read that. But if you go through the questions, many of the questions are from that, particularly a stem cell transplantation or the total lung transplantation. And these are the chapters which are in soft form, soft copy in the Harrison. So what I want to say that you have to survey wholesome the book. If you don't, the chances of missing the questions are far higher. You do concentrate on the table, figures, and footnotes, because the tables one, what was limitation of the previous question paper was we had to accommodate the whole question paper in said number of pages. So what was happening? We had to adhere to smaller questions, as smaller as stems, and then after figures and ECG, X-rays, or animation was not possible to put in. So this limitation has gone away. Now the soft copy, that is the electronic exam system, we can put lot many. And when you see the forerunner of the exam system, that is PGI Chandigarh, they always put in something like the animation also, that the RNA replication cycle of HIV, where will this block? So there are 4 arrows showing that, and they put an animation. So what was there, it is all gone. You have to think of that. You just believe it. There are in 300 questions, all the questions are same, only they are jumbled. They are jumbled on the chronology, they are jumbled on the options. So what is happening with 300 questions, we developed 1200 sets of the question paper, and all 1200 are randomly given to the students. So where if you see mostly one exam center, there is something like 200,000 or maximum 2500 candidates appear. So what is happening? The chances of getting one person same similar question is only 1 out of 1200. Two people out of one center can have the similar question. So anybody who is trying to copy is doing a fatal attempt. You all the people should not at all think on these lines. So what is happening? I have been observer in last year in the COVID infected students exam I was conducting in Jamshedpur. What was happening? That when we asked the student to sit apart, they felt too offended. And then I had to explain that you don't worry, your question is totally different from your friend's question. So don't worry and appear the exam. So that is very, very important. What is happening when the questions when the questions are not good, means there is the doubt on the statement, or when there is doubt on the option. What is happening in these conditions? These questions are declared open. When you declare one question open, what happens? Everybody who has attempted gets 4 marks. So what is happening? That the competition goes far below. And when after this happens, the person who has set and validated, and they are not allowed to be part of the exam process for 2 years. So it is a very severe punishment offered. So there will be every chance that the question will not be wrong. And that is, in the last 2 years, there were only 2 which were claimed and made open. You may have heard of it. And in NEET UG, in last 4 or 5 years, there were only 2. So what I want to say, you when you find that the some of the times there is problem in the network or with the connection or something like that, rarely it occurs. What can happen still? That the question papers, certain part it doesn't come. I have noted once or twice that the whole graph is not coming on the screen. The table is not coming on the screen. When there is the match, the two options is there. In those conditions, what is advisable? Immediately inform the supervisor. When you inform the supervisor, there is a control button in through which we can access and we can make it good, and we can also give you extra time to do it. So these are the ways national board does it. It is a very fair process. If you are constrained for some reason, so you don't feel shy to inform, and then after, the necessary guidance will be provided to you. What was previously asked questions? Which of the following is not the cause of typhoid fever? So, and last option will be none of the above. The negative stems are mostly out, or all of the above are mostly out. There is hardly one, any system uses. So that is why please be sure that not to go with that. And most of the times when you using the guides and other things, you will still, I find, the students practice that. These all are correct except one, or this like that. So these are mostly negative stem, mostly out. They are hardly used in the exam process, and you will find that mostly they are out. First and foremost, I will ask you to read the question fully and make sure what is asked. When we use, it is sometime I find the student go through the options, and after reading the option, you read the stem. So what will happen? Your mind is biased, and then after you read the option. The first thing, you read the whole question. You read the stem first, and then come to option. If you don't do it, you may miss the question. And this is a competitive exam. Even 1 marks losing or one question wrong can pull you down by a few thousand positions. So you can understand how important it is to attempt correctly, then and read correctly. These are the ones which is very important, that read the question fully, not that you read the options fully. And this should be borne in mind when you appear for the exam, or even practice exam also. You practice the points I am bringing out, you will yourself find the differences. This exam is elimination also. It is not that the we unless we grade the student, we cannot make the appropriate seat adjustment and other things. So what is that? One person can be right and whole crowd may be wrong. So don't always follow that he has said once or he has said twice. Think it over. You may be having the answer, and then after go with that. Always there is a question paper and declared correct answer. You may have heard that the board had not declared the correct answers, and then after, the time to contest the answer was not offered, and that is why the results were delayed. So this has happened, but it will not happen. In India, the transparency is the key of the exam, and at all level, it is ensured that there is the equal chance of benefit to all the candidates. So that is very, very important. And in 10 years, two toppers have brought in wrong questions. So you can understand how difficult it is to come with that. And when now you find that in IIT mains and the other exams, what you are finding, there is 100% score. Even NEET UG, there was 100% score. So what is happening? The questions will be framed. We will the whole system will not allow to go with a fixed idea that it will go to the conventional. It has to be grading, has to be offered, and for that reason, there will be exams. There will be some recent exams, preferred known facts, or the recent advances, which will be put in, which will distinguish the students. So that is very important. Don't feel the whole crowd is right and one is wrong. This is not like that. The exam will be based on the scientific facts with the available knowledge, and then after validated, then after it will come to you. So be patient with that. Don't jump. The question will be moderate, difficult, and easy. So what I want to say, easy. Easy is the must know ones. When you go with your MBBS syllabus, there are lot many things are there which are must know. And in UG exam, you find the MCQ out of 15 MCQs, around 12 are from must know. Why it is there? Because they want to make a baseline. It is not based on those exams. You will not find most of the MCQs to the NEET exam. So why it is like that? But NEET will have a substantial amount of easy means that must know series. Moderate ones are the ones which is preferred to know. Preferred to know are the ones which is little higher than the MBBS, and difficult ones are recent advances or the with high conceptual requirement, or a problem which is complex in nature, which requires time or more application of 3 to 4 concepts simultaneously. So these are the three grades. What will happen? With that, the easy ones and moderate ones are the ones who will put you in the list. And the difficult one will take you to the rank, which is important for you. So first to start is the easy ones. Let please go inside the list. Moderate ones, just sail through the higher level, and difficult one, get your choice center, the choice subject, and like that. The proportion will keep changing. What is happening here? That every year the passing percentage, that is the qualification, something like 30 percentile or 20 percentile, and like that. So the what is happening is that the board ultimately aims to improve the standard of teaching, and the whole medical commission and whole nation wants that the quality of doctors should improve. So what they will do it? They will improve upon the easy to moderate proportion or moderate to difficult proportion. And that is how this exam will evolve over a period of time. So what you find when we set the exams, we most of the examiners are asked the grade the question. When the churning process happens, again there is the fixed proportion are offered, that the 30% will be say from moderate or 50% will be from easy, and like that. So if it is proportion is to be determined by the board directive for the year, and it is done by the computer, not the one person who is sitting like that. And then after it is moderated and validated, and then after proofread, and then it goes to the exam. So what is happening that the all three levels of preparations are must. It is not that you prepare only difficult or moderate ones. One of the student asked me that the sum of the exams questions just was a true copy of the exam of the MRCP or something related to the clinical group of USMLE. I will only say that we believe in the concept relevant to India. And that is why our questions may match, but we will not be taking in total questions from any of the board, and like that. The question which comes into the exam is the property of the board. Nobody copies it. If somebody is doing it, he will be penalized suitably. So what I want to say that the don't go with the idea. I have seen a student need preparing a student reading the USMLE CK book or clinical science CS book, and then after they are preparing for that. What I will suggest in that, when we the whole process is public, national board has prepared the how the exam is done. Everything it is in public. In the common prospectus, you will find everything. So what is there? Why you are doing something catching the nose by this route. Why not straight away come to your textbook, prescribed textbook, and do with that? So that is very important. The proportion, you cannot think of that. That is the board's last moment decision, and then after it comes with that. But I will definitely say there will be some for that. Easy ones will be there, moderate one will be there, and difficult one to segregate which is the better student, which has to be given 5 year in neurosurgery in step one, or who has to be given some unpopular seat and like that. So we have to do with that. So you will that. What is the difference in the ANI exam, Institute of National Exam, Importance Exam, and the NEET exam? Let me clarify. The National Institute exam has got the multiple choice question. 4 and 1, 2, 3 are correct, and like that. They further pins down. Second thing is that there will be many more questions which will be of difficult and moderate variety. So that is very important. If you prepare the easy ones, moderate one, and difficult one, it is not that you have to prepare differently for the NI and like that. When I will come to the institution wise preferred areas, I will definitely cover that also. But I will do emphasize here that the easy, moderate, and difficult, all types of exam will be there. You must put in at all the level. It's not that you ignore any part of it. What is there? That with the exam, electronic exam system has improved the process. You see, it is many of the exams are still hard copy. National, that is the Royal College exam, MRCS or MRCP exam. Still the hard print papers comes, and then after the OMR seat comes. What is happening here in the this totally illustration? In that, what is there? There are only 4 to 5 X-rays in the 100 exams, 100 question papers. What is here? You can put in, if the board desires, he can put in 200 ECGs in out of 300 exam question. You can put in as many as possible. So the issue is facts, figures, illustrations, animations. Now there is no more limitation. It is not at all challenge, which was there before for the exams. Exams have become more focused and easy to conduct. That is, you can understand the exam. It is conducted in no time. Everybody is in. All students are in. Then paper comes. Then after the decrypted, and after that decryption, the paper is given, and then after exam process starts. In the meantime, all the who has appeared for the exam, the biometrics and everything is collected. It is very fair and focused exam, and very easy to conduct. The issue of broadband and connectivity has limited the solution, but it is with the board and the provider. The TCS, that is the IN services, what is they are doing? They ensure that there is adequate connectivity, adequate power, everything is there. And the bloggers, the blockers, everything is in place. Then only the exam centers are allotted, and they are paid handsomely. And this is a private company. We don't know that anywhere there is the failure or like that. If there is some confusion or one or odd things are there, still it can be improved upon by local thing, and national board center is available to resolve the issue. So exam process has improved, and now you understand this. The respect of this exam is increasing day by day. Every day you see, every year you will fairness, the transparency, the accuracy, and the way it is conducted is improving day by day. And all the examinees are given the feedback link, on which any of the difficulty they feel that they can share it to that, and it is recorded, discussed, deliberated, and any implementable point is implemented in no time. And you will be surprised to know our health minister, then health minister, respected Harshvardhanji, was very, very particular to improve upon the things. And it was understood that the autonomy of the board, the transparency, and everything should be beyond doubt that it should not be there. And what is there? With the best of the overseeing surveillance system, most of the exam center has got the camera. Everything is recorded, and there is hardly any malpractice. There is nothing which is, you can say, is bad. And what you are here, that the it is best conducted exam, very efficient, all transparent ways. Ranking of the exam is improving very appreciably. And but the sad thing, which as a teacher, which perturbs me, that qualifying percentile is falling day by day. When we see that the lot many seats are vacant in the mop round, if the seats are given like something like that. And what has happened, that this process really makes me sad, that when 300 questions and somebody only gets the 20th percentile out of, say, he has just scored 85 or 83, what he is given a seat. And most, even if you appear only the must know questions, you will get more than 50%. So what is happening, that the right approach is not being practiced by the students, and that is why the standard, the falling percentile is really sad. So this my video was to express my pains also. I always talk in this class also, that when you do well, our success is there. Whole the teaching community feels happy. One thing I will immediately say: don't assume the question is difficult or easy unless you have read twice. And if you see, per question, there is something like valuable 37, 38 seconds always at hand to think, write, read, and practice. That is very, very important. Unless you do it, read it, it is not doing well. So focus after you reading the stem, then you focus on the options. When you come to the options, then make sure what you are doing, and then you do it. And after that, if you are uncomfortable, don't save it. The saving option is at the end also. So if you are convinced that you should not save the option, just leave it and mark it, and then after save after some time. That is the best way. Now I see, give some examples. You need not answer the question only seeing the figure or knowing the sketchy detail. Sorry, my spelling mistake. What you are seeing here, this is the two electrocardiograms. Which one will you treat first and why? This is the question. What you are finding here, you can very easily understand. This is a VT and this is a AF. So what are the chances of these two, the life threat? Very less compared to this. So if you see those two ECGs, what will happen? Don't come to the conclusion. You read this. This question is so easy. It is from the must know. But if you see only ECG, two ECGs, you may get scared. So what I want to say, don't jump to the conclusion the question is difficult or easy. That is very, very important. You see, immediate treatment to this patient, what you are finding this ECG. In this ECG, there is tall T, QRS is marked, and something like sine wave pattern is there. So this is a case of hyperkalemia. In hyperkalemia, the question asked is what is the immediate treatment to this patient? The immediate treatment is, answer is very simple. You have to preserve the heart, and the immediate treatment is IV calcium gluconate. Every year, the medical emergencies are important part of the exam. You cannot ignore it. What is the immediate treatment? What will it do? It will make the insulin glucose drip will make the extra cellular potassium to intracellular. rectal chelate, what it will do? It will, the enterohepatic circulation, enterohepatic circulation of potassium will be broken by this. It will take at least 1.5 days to act. This will require another 1 hour to act. But this one is the immediate. The question is immediate. This is such a small question, a question. But what is there? Many of the students get scared. And if you see the question-wise correct score with the different exam groups, I have been seeing it with my students bringing after the exam tests of different coaching institute. I still find only 47% answering right. So unless you read it, and if you see, ask the question about this to the students, you will find most of the people know it. Now the same question is there. You see, what is the definitive treatment of this patient? Definitive treatment means what? The same ECG is there. You see previous one, and this is the next one. The same is there. The only one word is changed: the definite and immediate. The definite one, what is the answer? You have to take out this potassium, because calcium gluconate can save the heart from going down. Nebulized salbutamol only put extra to intra. Insulin, again, glucose insulin extra to intra. The only definitive in this group is that the rectal caselate, which is a long acting and like that. So, and if there is the hemodialysis is there, the answer remains the hemodialysis. So you see, one question, only one word change can make the huge difference. When you come to the institute of national importance, there is very good thing which has happened. What is happening that the institutes are rotating to take the exams for all over the national institutes. There is JIPMER, 5 All India institutes. Then after the IMS BHU, the neurosciences. There are a lot many institutes which are going to that. So what is happening now? This is very good thing is happening. That you need not prepare institute specific. You are preparing for, say, institute specifics, and that center has got very few seats, 2 seats only. 1 seat in open and 1 seat in reserve category. So what is happening now? Your subject you are preparing. You know that all the institutions are will be rotating, and they composition I have explained you. There will mostly have the difficult ones and the preferred to know. So their question preparation is little more exhaustive. They have to be incorporating not only the basic book or the relevant postgraduate books also. So that is very important. These are the 2 things you have to think of that. There are specific areas for the preparation. What is difference in this? In NEET, there is the top rank and last selected guy has got a score difference of something like 40 percentile. But what is happening in All India Institute exam? There are 4 seats, or in PGI exam, there are 4 seats. The first guy has got the 492, second guy, last guy has got 488. Even 4 marks difference. There is hardly 2 percentile difference. So there is no issue of percentile. There is no issue of cutoff. By the 90th, 90th, 95th percentile, all the seats are over. The question banks are more up to date, and there is institutional ownership. The institutions have got their own way of conducting exam. As you see, there are certain areas in which the particular institutions they take pride on, and such as the PGI. Most of the years I have been seeing the remembered question bank or the published question bank. They do believe the questions particularly on the recent advances, drugs and diagnostics. These are very, very important. you will find that P24 for HIV has been asked at least 4-5 times. The different diagnostics, that is interferon gold, has been asked 2-3 times. The bedaquiline has been asked. So there is lot many areas in which they are first one to ask. AIMS group, the clinical orientation and specificity and sensitivity of the clinical test, you will find many times they have asked. Particularly the trop-I specificity, the N-acetyl cysteine, that is the NGAL specificity in acute renal failure. There are many times they have asked. That a clinical problem-based learning, they believe in that, and they are always asking on that. In JIPMER and BHU, they ask the genetics, newer syndromes. These are their fed. Many times you will find first-time word syndromes they have asked in that, and this is there. Newer drugs, they again, they are also the choice. In NIMHAMS, electro EEG tractography related question. Mostly every year they will ask something about the tracts, channelopathies. These are their particular areas in which they have always been asking. In two aims, particularly, I have gone through recently. One is the Jodhpur. They always ask about the research methodology, and in that they always ask about the statistical test. Mac-Nemer test is used for that, and like that. So there, I have these newer institution. I have hardly conducted 4-5 exams. So if there is a trend, I can't vouch on that. But definitely in last 5-year questions, this is the one which is very, very important. I have understood in the while going through and teaching with that. I am finishing my talk, but I have to say a few important things. The first and foremost important thing is that teacher shows the path. We will show you what it to do. You have to do it yourself. Whatever I have talked is all the public ones. It is nothing confidential I have talked about that, but mostly forgotten, not understood, and not practiced. So you have to see. And small track to highway, track not, my mistake. You have to make a small track in the way you have to do, and you will reach on the highway where many people will follow you and many vehicles and fleets will go through it. What we have learned in the 5 years, the exam system has improved tremendously. You see, last 5 years we have progressed a lot, but these are not when we will have people who are much better, much understood, and much better uh, qualified, and they will lead the way to the healthcare system. I will particularly emphasize on two more aspects. Particularly when we come to, we are many of the papers are coming internal circulations and medical education units circulars about the next. We expect next by 2022. What is the requirement? The requirement will be the uniformity. And for uniformity, mostly there will be hard fact questions which will be coming. And particularly, they will be something like the must know series will definitely be there. And there will be significant portion of the questions which will have the preferred to know and decent advances. So there will be room for everybody, but there will be the minimum criteria which has to be done. The National Medical Council do believe that Indian medical graduate should be more clinically oriented than with the process and procedure oriented. There should be evidence based. They should be up to date. They should have research aptitude. So these are the requirement which is important, and the skill based knowledge is important. So what we are evolving through? We are evolving through the process in which the more and more knowledge has to be accumulated, condensed, stored, and then after retrieved in short period of time. And that is how most of the exams will have the something like the concepts, the charts, flow charts, illustrations, and there is only one institute which puts animation, that is PGI. Rest all are nothing, not putting in. So this will come the call of the day. So this is the way we will progress, and we will definitely have better exam system, better graduates coming out and good postgraduates. And I am very hopeful that the challenges of the exams which has been there in past are done away with the many of the improvements we have done with that. And days are not far when we will have a uniform system, gradually improving system, and we will be very happy to see all our students doing well in their practice. One more thing which has particularly happened in last 1 year, that is the limited clinical exposure and clinical training. What has happened in this exam system? This is a very big challenge nationwide or worldwide, because the hospitals were closed, the students for their safety were sent home, and like that challenge were there. But these exams were little more passing percentage, and some leniency was there. But it is the one-time measure, the call of the day. It is not the thing to remain, because the Indian medical graduate success rate in the international exams are still far higher than many of the developing countries or the countries of similar stature. So what we have to see, that where we have to inch ahead, and we have to further progress. I have talked about how to prepare, what to expect, how to go about, and I am sure you will do well. You will go with that. The next class I will definitely take as some concrete things at hand which are published, and as the data comes up, how to go with the first class. I am really thankful, and I believe that my talk will definitely be useful to you. Thank you, sir.
Thank you, Colonel Oja. It was a wonderful perspective lecture, a lot of clarity, I think, for the students, and the most important thing is to understand that it's not about, first, it's not that they have to read all kinds of guide. I think what you really brought out well was, thorough understanding of the subject, reading the textbook properly. I think that's very important, because that's what you always tell people, whatever you do, eventually you have to get back to your textbook. That's where thoroughness is going to come. There are some questions I'll just follow, which have come from the students.
Yes,
so,
sir.
First one is, sir, which textbook would you recommend, especially for vast subjects like medicine and surgery?
I will recommend Kumar Clark and Davidson, which is the National Medical Guideline. In fact, we have National Medical Guideline has hardly deliberated on it, but MCI, it has already talked about that, and most of the medical university follow that. For the Indian type of diseases, particularly say leprosy, say the tuberculosis, the malaria, and waterborne diseases, I will recommend you to read the Park and API textbook of medicine. These are two are very well written, and I will recommend. Particularly, I will not recommend you people to read the books which are in question answer format. I will not name it on the platform, but I am sure you must be holding it. But they are just the one man's perspective about the concept. You should not read that. One man's perspective is not the thing. It is that the Davidson, you see, there are 114 contributors and 17 sub editors and 8 editors. You can understand how comprehensive it is. In Kumar Clark, again, there are 4 editors, 12 sub-editors, and around 100 contributors. So you cannot take away the wisdom of 100 to be understood by one person, and which will sail you through the medical career. My humble request from all of you, please don't adhere to one man's book, particularly written for exam point of view, because it will not make you successful in the exam and the practice.
I think that's a very pertinent point you brought out. And surgery, what would you suggest?
Surgery is universal, Bailey and love.
Yeah.
Bailey and love. And for the practices, you have to that the principles short practice, that is the pi handicraft. These are the two which you have to do it. In particularly, sir, you remember, if you don't show it to the HOD these books, you will not get the internship completion certificate in the training hospital and armed forces. So that is the way we have to ensure it. And I feel that you must do this one, because the handicraft is very, very important. How to hold the scalpel, how to hold the needle, and there I've got a lot of pictures in that. So that is the thing you have to do with that. In the broad subject, I will recommend both of them.
Actually, I also feel one thing just came to my mind. Like when you're reading one page of Davidson, see, if you read it like a storybook, I don't think it really going to help you. You got to make your notes from that. I think that's something, you got to be very clear, because eventually it is it looks to be like a effort. See, because when you talk to the students in their exam, they all say the last 3 months, no, you have to get, like, at least I got a lot of feedback from my students who have passed out. They said that's at least 3 months for revision, because so that means you got to have your material ready for what you're going to read in the last 3 months. If you start reading new stuff in the thing, like there's one of my students who told me that, sir, I wasted a lot of time in the last 3-4 months reading new things which I felt was not good at. So I think that's the, the journey is very important, which all of you must understand. It's like, you have to go in a methodical way. What Colonel OJHA was pointing out is a very, like, see, it's something, like, it's not that you are preparing from NEET, means you will start reading during internship. No, the preparation begins when your clinical starts. That is why I would say 3rd semester onward, you should already have your planning starting. If you have to give next at 4.5 years, so after 1 year means it's giving you 3.5 years to prepare. That is how you should prepare. I think, what do you say, Colonel OJHA? It's going to be a long term.
Surely, sir.
There is no.
If you agree, sir, this whole CBME which has come,
yeah,
what is there? That is the integration of the whole system which is occurring. And what is happening that in NCD, that non-communicable diseases, in 4th term we are teaching 6 diseases. For 4th term we are giving 4 communicable diseases. And if you just follow this curriculum, you will be very, very comfortable. By the 8th term, whole medicine is over. You have got 6 months to revise, rehash, and like that. And if there is a well-focused institute, something like in a FMC, we have got 250 teaching hours for medicine, while IMG requires 150 hours. The medicine is revised twice in UG. And many of the institutions, particularly in our institution also, we have got the 6 classes per month of medicine. So this way, what we implement that in 150 hours, we will still having some 25 hours for revision if the student desire. So that is very easy to do it, sir. And the student, if they are convinced, it can be done, and they will be very comfortable sail through for all of them. And heartening for us, they are doing very well.
Yes. And I think I was so much impressed by the point you made, the immediate management of hyperkalemia, the definitive management. I think all the students must understand that you need to read the question very well. If you are not, in fact, I was also an expert in one of the centers in Kaladi I had gone. I fully agree with Colonel Oja that, the absolute, the TCS gentleman comes at 6:30 in the morning. I was there at 7. There is nothing, no way any, we have to even wrote down what time it opens and the paper comes. No way. I don't think any kind of cheating or anything is possible. That way you have to accept that the uh, system has got very good transparency, and their system is
Transparency,
very,
very good, sir.
transparency is there. Uh, the, the next question, Colonel Oja, is how can we incorporate entrance preparation into our mainstream daily learning, as the university exams are theory based and entrance is MCQ based? So this is probably for the next few, maybe 1 or 2 exams before the next takes over, and that becomes the
Yes,
actual MBBS. Maybe for
sir.
the
Yes, sir. Sir, I will emphasize only one thing, that in the NEET exam or next exam, whatever comes, but the ANICTET, that Institute of National Importance exam, it is so far, it is clarity that will remain separate. That will not merge in that. So what is happening now? The next will be applicable to All India Institute or no? That is clarity is still not come. But the two things I am very clear on the based published data, that is the in NEET exam, you have to keep around 50% of the question from must know series. When you are preparing for the university exam, again university exam also, it is a very clean and structured exam, uh, which is not there in national board DNB exam. What is happening in that? In university exam, your question is again prepared by somebody, validated by somebody, and somebody writes in the specified period of time whether it is lengthy or not. That is in MUHS code of exam, it is done. So what is happening in university exam also, we adhere to the local problems, the national problems, and the national curriculum which is there. If you are preparing with the university exam well, concept wise, you are already building up your a castle for the next NEET exam. So it is not separate in that. The only thing, if you see what is to bring in objectivity in the university exam, the question is broken into part, and for that reason you will feel that the every concept is 3 plus 3 plus 2, it is put in like that. If you catch all three concepts, understand and put it correctly, you are preparing far better. See what has happened in this MCI skill based learning. Previously, say I was asking somebody to demonstrate the uh, plantar reflex. If he is demonstrating correctly, he is giving correct perspective, and he is giving the limitation of the test and alternatives. If he answers all four, he gets 4 out of 4. So what is happening here? Why this has come up? The clinical based learning exactly is something, it has come mathematical. So what I want to emphasize, if you do the thorough ones, if you omit, say, limitation of the plantar reflex, so what will happen? You will lose 1 mark. You out of 4, you will get 3 only. If you only demonstrate and you cannot explain, you will get 1 marks only. So with this, if you prepare your university exam well, you will definitely do well in the NEET exam. So don't feel that they are separate. You prepare with the university exam with depth, definitely you do well for your NEET exam. Don't worry on this.
yeah, and very true and very nicely brought out. And there's another question. At the UG level, the number of patients we see on a variety of cases would be limited compared to repeaters who have more clinical exposure and are better prepared. How can we bridge this gap?
Yeah, that is a challenge, definitely. I agree. Because there are the smaller colleges and bigger colleges, rich colleges and poor colleges. Football are different. But if you adhere to the minimum skills requirement, we have specified skills in the MCI, this skill based ones. If you know how to prepare the spleen, whether you palpate 5 spleen or 15 spleen correctly, you learn with 5 also. So don't worry on that. These variation will be there. But if you adhere to the specified skill and the commonly asked questions and the cases, you will do well. Don't worry. We will have a thought on it, how to make it streamlined by particularly using audio visual means with the better center to the smaller centers. But still, it is not in my vision, my understanding that it is coming up in a year or two. And let it be. I do agree this is the concern. Everybody wants to be trained better on the small cases or difficult cases, and there is limitation of the center. We do agree, but let us hope that it will resolve.
Yeah, that's a very nicely brought out. I think you should not have fear. You see, if you ask me, the preparation has to be when you are preparing well. So you also remember that you are running in. You are the regular. You are the one attempting at 4.5. The guy who has not made it in the first attempt, he is coming. Don't think that extra preparation. See, it's not always like that. You will still have you are the one with the momentum actually. I would rather put it that way. So don't think it the other way. I don't think there's like, you see, it's not like Olympics, a 30-year-old chap will earn a 19. No, you find 18-year-old chap wins the gold medal. It's not like that. So not necessary. I think it's all in the mind. What Colonel OJHA says, I fully agree with him. If you're well prepared, and I think as far as clinical is concerned, no, you need to have more small group discussions. That is what self-directed learning is all about. Now, if you look at the question paper also, now they are what is basically, now it is no longer like at our times it used to happen, people will say this topic was not covered, that 2 questions came from that. That doesn't happen. Now you're supposed to map the questions. Now you cannot do, you have to make sure that all the core is mapped. You cannot miss out things. So it is being done in a very deliberate manner, your question papers also. You will see that even in your 3rd MB part 1, you will see. So you're supposed to map it. It's very, very, very interesting actually. The last question is, most of questions we may get clarity if we have exposure to super specialty subjects like neurology and cardiology, but as an undergraduate level, we get very little practical time in these subjects, even as interns. How to get over this, sir?
No, this super specialty is coming. I will tell you a very small anecdote and you will understand it well. The whole IMG is required to understand, to identify the syndrome. It is not that at the UG level you have to come to a specific diagnosis, and you are supposed to offer immediate care. So these are the 2 straight skills we Indian medical graduates should have. Say you have got a patient with neck pain and fever. If you can understand the possibility of meningitis, whether it is tuberculosis or it is the bacterial or viral, and you will start adequately the antibiotics based on your local epidemiological data, we are happy. You need not be sure how long. I will not expect my student to understand fungal meningitis. The meningitis is one and the same. The fungal meningitis is a postgraduate topic. The meningitis with complication is a postgraduate topic. So don't worry what view is higher ones. The diseases are one and the same. The depth of knowledge varies as per your class. UG should answer, sir, it is the 1 to 5 year of age group. These are the 4 pathogen I can understand. If I ask the same question to my postgraduate, he answers these are the 15 pathogens. And if the same meningitis is deliberated at the NIMHANS, they will come to the rare causes, the complicated meningitis, and like that. So, yeah, what I will emphasize that if you identify the syndrome and immediate treatment, you can tell me, we will be the happiest to give you the degree, and you will be able to prosper in life. Even if I teach you a lot of medicine, your surgery part will be unbalanced. So it is not that the curriculum is developed such that in 150 hours we train you enough that you understand the syndrome and you start then immediately. So don't get disheartened that this is very complex or very difficult and like that. You just understand the syndrome, and then after you write your approach to this problem. And if you correctly approach, the whole battle is won. Because the 2 days when he reaches to a specialist center or super specialist center, if he is adequately treated, the goal is achieved. So that is the way I look at it. And I really appreciate your concern because you want to learn more. I am really happy for your question.
So basically, I thank you for the excellent lecture. I hope you're not getting late, Colonel.
No, sir. No, sir.
I'll do one thing. I had jotted down a few points. I thought I'll just share. You may, what I would advise, what I would request you is to give your perspective as and when whatever comes through. See, one thing which I feel is not that what I learned from my students was that you've got to keep your last 3 months for revision. They say that last, 1 month and 145 days is not enough. So there's one suggestion. Please finish your material by that time. If you have not even done certain things, you leave them, but your revision should not be compromised. Keep that in mind. Then those who are working, who are repeating the exam, there are people I think today who are, who will be repeating the exam. They always say that don't work in the last 2 to 3 months. It's always better keep it for preparation, because some people felt that because they were working, they didn't get adequate time to revise. So this one of the this I'm sharing. Then one of the things, which one of our 2-3 people have told me is that if you're going at the questions, if you are say getting stuck on too many questions in the beginning and you don't reach the end, you may lose 30-40 marks in the end, and they may be actually quite easy questions. So what Colonel OJHA was pointing out, you can always come back and save it later also. So whatever the purpose is, make sure that you touch the 300 in reasonable time, then you come back. It should not happen that last 30 questions are left. Many of them could have got you marks. So that's something you should not happen. What do you say, Colonel OJHA, to that?
Definitely, sir. Definitely, sir. You must survey all the questions and attempt the correctly whatever you know. And the exam is not that you will know all the answers.
Yes.
It is something like that. The whole medicine is on the scientific calculated speculation. What is happening inside the under diaphragm, I can't understand, because neither it is seen by my hands or not the clinical signs are enough. So what is there? If I have to start, it is something like the history clinical examination and what is epidemiologically prevalent in that area. And then after I can say whether it is the pneumonia or it is something like the subdiaphragmatic abscess. So you have to make a calculated risk and you have to make a judgment. So that is the way the exam system is evolved around. So don't feel that you don't know all the 4 answers. If you can eliminate 3 and with the reasonable surety, you know that this is likely, you go with that. If you leave that, the 75% of the knowledge is not conveyed to the examiner. That is the very important. If you can eliminate 2 options, and the 3rd and 4th you are quite confused, or you have got very small iota of doubt, still you answer. There is still chances of getting marks. And I will say in NEET, one question right or wrong puts you above 1,000 of the position. So you can think of that is the way you have to answer it. So this is my advice. Don't get disheartened. The questions are many. Because it is for everybody, the best prepared one to the come in student. So don't worry on that. There will be enough food for everybody. You do whatever best you can. Don't worry. You appear the best and definitely you will get your due.
Yatha Shakti, you should attempt. That is very important. One thing from my experience, I would say if you have to read 18 books 10 times versus 180 books one time, I will choose the former. So you read, be thorough with, like, suppose you have decided that I am reading, but you want to read one chapter from another book, then better don't read from this book. Don't read from 2, 3 books, same chapter. It creates sort of confusion also sometimes. Better to decide as to what you are going to prepare. I think that's something where I found clarity has to be there. And when you prepare like that, then as you move, it comes out. Like when I was preparing, I remember there was a pathology MCQ of the book, the main Robbins. You remember Colonel OJHA, one
Yes, sir.
blue colored cover used to be
Yes,
there.
sir.
Right?
Yes, sir. Yes, sir.
We were in that era where you had to go by book. So I remember that was a wonderful book. So I found that it was excellent preparation. So you could, and you can get back to the Robbins and read that part. So sometimes you have to, like Bailey and Love has one MCQ book, 1,000 MCQs.
Yes, sir. Yes,
It's
sir.
a very, I felt in that entrance, that time, I think 18 questions came out of 50 from that book only. Verbatim, but more or less similar type of. So that would help you. Repetitive reading. In fact, one of the, from Bhatia's, Dr. Bhatia's group, somebody had come.
Yes, sir.
One of the ENT surgeon, he was a trainer. He was telling that what you read today, you read tomorrow. It's a very important. What you read today, revise tomorrow. If you don't revise, then what happens that you lose the advantage actually, because after all, everyone has limitations. More mock tests. One of the thing I have seen, a lot of people, they do very few mock tests. You have to do more mock tests. If you see the people who are preparing for the IIMs, they do a lot of mock tests. Similarly, you have to do a lot of mock tests. And mock test is not that you have to do once. You'll have to do more number of times so that you become thorough, right? I found that research, people who do research do well in academically, they do better over a period of time. It's a known fact. Anyone who does good research or takes part in research, he develops a more scientific thought process. So in my own, recently we are doing 65 papers. We did the undergraduates, out of which 24 have been published, including Scopus, PubMed. So I've seen that always gets, you get the clear concept how thing is happening. Right? That is important. Lunch hour. I remember lunch hour is very important. Like, because always people say I have less time. Lunch hour, why you want to waste 1 hour? When I was in AIMS doing my rheumatology, our senior SR, the senior SR was Dr. Rahul Grover. He's a nephrologist now. So what he would do, we would have lunch in 20-25 minutes. Then you go to the library and everybody picks up two articles. Then next about 45 minutes, go through. So, and then we had a discussion. So what happens? Don't waste time. I always tell the interns, see, if you are not getting much time during working hours, lunch hour, generally nobody will interrupt. Have your lunch in 15 minutes. Make sure you read 30 MCQs in that period. So if you think that time will come to you on a platter, it won't. Like there are sometimes I talk to students, they are finishing a community medicine 5 o'clock. As how many hours do you read? So 2 hours. It's an apology. 5 hours from 5 in the evening till 12 at night. But it's quite difficult to understand how a person is reading only for 1 or 2 hours when he is giving a national level. Like you have seen a batsman when he stands, he looks around and then he sees around the whole, he knows the arena. So you look at your competition, look at the size of the country. I think, if anybody who's taking these exams lightly and then not clearing and saying that, I think he has to blame himself. These are highly competitive exams. It's a very competitive world. Whether it is MRCP, whether it is MRCP is at a later stage. Whether to do the PLAB exam or the MLE or the NEET or the INE. Every exam is difficult. It's a huge competition. Don't waste your time. Now this tocilizumab, now see 2021. What's Colonel OJHA pointed out, what is coming around? That disease question. It'll come. I told my students this. Yes. Tocilizumab is a likely question. It came this year. And then they all told me, sir, you told. It came because interleukin-6 inhibitor is useful in rheumatoid. I told you guys also. The second is cytokine storm. So it's so much in the thing. And if that question you lose, you are losing 4 marks. What Colonel OJHA says that it puts you. How many maybe more than 1,000 ranks behind. So never lose on the questions which are, very, very relevant at that time. All of you, I see generally, you all use the mobile for this thing, but always remember writing is very important. So I always tell the students, write, because we all wrote. We always wrote. We never had this, but now I see many people are reading. Don't read like a storybook. That it will not work. You need to keep writing. Otherwise, you won't get the question. You can use the mobile, but you must write. Like clinical based questions. Now, see, you have to understand that certain, like I was just asking the other day, simple thing like a patient of pneumonia, right lower lobe.
I collect the phone and come, sir. 1 minute.
Yeah, sure. Like pneumonia, right lower lobe pneumonia patient has. Now, they say that after 7 days of antibiotic therapy, patient is asymptomatic. Now, the X-ray shows some radiological opacities in the right lower zone. And what would be and there is a minimal pleural effusion. Okay. What is the disposal? Now, the fact remains, like, when I ask this, see, the catch word is patient is asymptomatic. So, after 7 days of antibiotic therapy, the patient is asymptomatic. That he is telling you, intravenous antibiotics. But after 7 days, he is trying to confuse you by saying there are radiological. But you also know that radiological resolution can be after the clinical resolution. So that is where you have to be careful. That, the key word, if you missed out that in the question which Colonel OJHA said, that he was saying the definitive treatment and the immediate treatment. If you overlook that, then that question is gone for you. So you must read the question very carefully, deliberate on the question, where topic. My advice is also, see, many of the points which some of the students have asked, how to improve your clinical experience. I would suggest you should read case reports. You should read CPCs. You should read review articles to improve your thing. So sometimes you have to, like in a case report, when you read, your clinical acumen will get more thorough. And that is the time when you are reading, that is the time you should also have clarity about your Hutchison under or, MacLeod. Do read it. See, then there are certain questions which I would see, like, I always remember anti-U1 RNP, ribonucleoprotein. It's a very popular question. It will be basically mixed connective tissue disorder. But logic, sometimes everything will not be logical. What Colonel OJHA pointed out, some percentage will be difficult question. So this could be in that category, isn't it? Anti-Rho antibody, pregnant lady has, anti-Rho antibody in high titer. Now, basically that means complete heart block or congenital heart block for the neonate is a risk. So you have to know that fact. So such type of questions are also there. Everything is not a clinical question. You have fact-based question, right? Now, like Kawasaki disease, what is the therapy? Like anyone who says mugging type, he'll say everything Kawasaki vasculitis, steroid. No, it is IVIG. Antiphospholipid syndrome, what is the therapy? Primary therapy. It is anticoagulation. It's not steroid. Okay. So catch is everything cannot be generalized. You need to have specific knowledge also. And one thing, what I feel is that what actually Colonel OJHA was pointing out was that, keep bringing the standards very low, and so that people can just get into PG also is not good. I always tell people that in the Indian Army, the National Defense Academy has 300 seats, but they need not fill 300 vacancies. It may come only 280, 261, because if they are not up to the mark, they will not be taken. Services Selection Board, out of 25 people, 1 or 2, sometimes 4, sometimes nobody gets selected. So selection is also tough. Here it is quite different scenario. However, that is not the purpose of our discussion. Basically how to improve your performance and how to go towards it. Actually, I think that was where I think it was very well brought out by Colonel OJHA. He really covered it well. And I would personally advise, see, you have to work hard. There is no, it's a, see, the problem is there are 82,000 or something medical students, I think, 80,000 plus. Again, the figure I remember roughly, and 47,000 MD, MS, DNB seats. So everybody is not going to get PG. Now that is the problem. So one of the recommendation is that increase more DNB so that most people, because a lot of people are now wasting 4 years, 3 years trying to get into PG. I think that's something which, Colonel Loja, over to you. I think audio near. Huh? Sir, you're mute.
Yeah. Yes, sir. Now I can. I am really thankful, sir, for this wonderful opportunity. And as the things are very good, and I see with lot of positivity that the students will do well, and your sincere effort to make them understand the process. I am hardly invited to speak on these things, at least maximum in 2 or 3 times in a year. uh, and I will be happy to take any class if you offer me. And particularly, my passion is about the clinical medicine, which is dying its death. Unfortunately, many of the developed countries, particularly Australia, they have created 4 chairs in clinical medicine in Queensland University of there are 4 universities, they have come with the chairs. In India, we have got 2 chairs coming up, that is the HN Pandey chair in All India Institute of Medical Sciences, and one, this Sir Sundarlal chair is coming in the BHU. And what I will particularly tell the students, that the doctor's hand, eyes, smell, these are far valuable and easier way to diagnose than any of the gadgets you have. And many of the things, particularly illusions of a radiology classes, I take many of the places where the hand could tell the diagnosis, the image confused. So don't get perturbed. You are bright people, we have got lot of hope. And whatever I offered you, I am sure if you follow it, it will increase your score by at least 5 to 10%. And be honest to your books, not with the guides and the small books, because this is my advocacy and it will take you to the long way. And MacLeod and Hunter Hutchison, these are wonderful books. Even in postgraduates, I have been teaching, I have been showing demonstrations. And with the new thing which has come up, that the BMJ image gallery. If you don't understand some science, how to do it, you can go with the BMJ image gallery. So these are the things which will definitely do well. And I am very sure you will do well with the blessings of Amma and kind opportunity given by Marwa sir. I interact with you. Thank you. God bless you all.
Thank you. Thank you very much.
Thank you, sir.
Loja, very kind of you. And with this, we come to the end of this session. And we thank Colonel Loja and we thank all the delegates who have taken part in this session today. Thank you very much.
Nice. Good day, sir.
Thank you, sir. I'm sure that each and every student across the country has benefited from this session. And on behalf of each and every one of them, I would like to thank our moderator, Dr. Colonel Vishal Marwaha, and our eminent speaker for the day, Dr. Colonel ASHUTOSH OJHA, for sparing some time out of their busy and hectic schedules today. Also, I would like to extend my sincere gratitude to our organizing committee of SPASH 2021, our AV team, and our support team. You can log on to www.spash.co.in to know more about the upcoming events. Thank you.